Hi, so this is for discussion number 8. My discussion topic was number 1, and I'm supposed to recount on the key ideas 1 and 2 for chapter 5 and reflect on Paul Farmer's story and the personal and spiritual resources he was able to draw upon. So my first key idea says, the narrative of the profession of medicine has been described as having turned over time from one that described the provision of valuable service to society toward one characterized by more self-interested and commercial motivations among its members. So our author was talking about up until the 1950s and 60s, the main driving force of the field of medicine was beneficence, and the medical community and the hospitals and practices had the main driving force was helping their patients, and we can see that changed over time after that to self-interest, and we saw these big hospital and healthcare corporations that are more profit-driven. And our author described said that this can be characterized by deprofessionalism, proletarianization, and corporatization. And he said that many hazards arise when medicine's focus becomes the achievement of excess revenue over expense rather than serving the suffering. And I think that we can see that this is not only just in the overall field of medicine as a whole, but also into the people that make up that, such as doctors, and that maybe a lot of people want to become doctors because there's a certain status and reputation associated with being a doctor because they're seen very high in society and are well respected. And also this enables them to be able to make large amounts of money. And in my personal experience, I have seen doctors, roll up to the hospital driving their Tesla, but also the doctors that I had the privilege of working with and shadowing were very caring, and, when they worked with patients, you could see that they really cared, or it really seemed to the patient they really cared about the patient and weren't just trying to get through their hours to make their money. And Paul Farmer, I think we can all agree, it was not a doctor that was driven by wanting to make money, but he had a personal experience and really felt like he had a calling to help the poorest of the poor, as he described, the people of Haiti, and so that he felt most alive when he's helping others. And even if his organization or he wasn't making money, he was happy because he was helping people. The second key idea says health professional trainees experience significant contraindications between what they are taught in the classroom regarding their professional obligations and what they see enacted by professionals in the real world of clinical medicine. How they respond to these contraindications critically influence the development of their professional identities. So our author was talking about students are constantly taught in medical schools and healthcare training programs about how to be professional and have a good bedside manner. And then these students are getting thrown into clinical scenarios and clinical training, and the people and physicians that are training them are the opposite and are not practicing these the professionalism that they were taught they were supposed to have in the classroom. These students acknowledged that physicians had conflicts of interest, frank incompetence, and humor at the patient's expense, as well as inappropriately treating the patients and their families. And these students were seen as part of the healthcare team, but were too scared to say anything, because if they said anything to the physician or told on that physician, then that physician could refuse to work with them, and they could end up probably failing whatever rotation they were in, and their future career would be at jeopardy. And that would be an incredibly hard position to be in. I mean, I couldn't imagine, being willing to throw away everything that you've worked for so far and jeopardize your career by saying one thing, even if it is really bad. It's just, I don't even know what I would do in that position. I remember from my personal experience when my sister had back surgery, she was constantly in pain. She could hardly sleep, and I remember, at night, she could hardly sleep, but in the morning, the residents would just walk in, open the door, turn on all the lights, not say anything, just walk over and start doing physical exams on her, and she was startled, scared, and it was causing her pain. And, as a family member, you think, obviously, these residents would know that there's a better way to work with patients than that. But maybe these residents, this is how their training physicians acted, and, they learned that that was acceptable behavior. Now, looking at Farmer, it's not a doctor that did this, and he wasn't looking to get something out of, his experience, like having a conflict of interest. And I think his motives for, working in medicine were so pure, and when you really want to help someone that much, that the professionalism is just implied, and because you're not going to act in a way that's not professional because you really care for the people that you're trying to help. Now, talking about some resources that Farmer drew upon, it said that he wasn't religious, but I think one of the important things was that he went to Haiti before his medical training and built personal relationships with these people and saw the dire need of these people. And he mentioned that the needs of the people spur him on, not drag him down, and that whenever he was going through something, he could remember that's why those people were why he was doing what he was doing. And he wanted to, the Haitian people said something about God gives, but he doesn't divvy up, it's up to the people. And he wants to be those people that re-divvy up the loot of healthcare and help the poorest of the poor. And I think another thing, he said that he does not believe that goodness is scarce, and I think that if you can believe that there's goodness everywhere in people, then it's easier to, you'll still have hope for getting people to help you help other people, and so on and so forth. Thanks.